Good evening, everybody. I'm delighted to be here with you in this lovely winter evening of Nicosia and to present to you some slides and talk a little bit about my work. I'm a physicist, and in the last 20 years, since my PhD in physics and electrical engineering, followed by a postdoc in neuroscience at Harvard University in Boston, I've been dealing mostly with these kinds of technologies and studies that I'll present here today. More about myself later on, and I'll start with my presentation to tell you all about it. So my studies are about speech biomarkers in medical application, which means using speech as a marker, as an indicator to diagnose and screen and monitor and even treat medical conditions in patients, and as you'll see later on, even sometimes in doctors. So what are speech technologies in digital healthcare? So digital healthcare is all about computing and making healthcare more dynamic, more cost efficient, and help both doctors and patients to make things in a more convenient and efficient way. When speaking about speech technologies in digital healthcare, it's been there for a long time. We've been studying speech in these applications in all kinds of applications, like, for example, just speaking instead of texting or writing. If you're a busy doctor or if your hands are busy doing something else, then speech is a most natural and convenient way to just dictate to a computer your diagnosis or anything else. Definitely coming to a more sophisticated AI kind of applications, then all these little helpers from our cell phone ones to the operation theater, as we'll see here, where a robotic machine or any computer will just listen to you, to your commands, and perform all kinds of tasks for you. These robots and digital helpers have penetrating all kinds of other applications in healthcare, including just being there as carer, as caregivers for the needy, the elderly, and the sick. All these employ speech as the most natural way to communicate and connect, with each other, which we do all the time naturally. So jumping to how does this work? How do these technologies actually do the trick and are able to listen and to understand and to give some sort of information, markers or indicators on a patient's health? So it starts with just recording speech, which is then given to a machine that does speech processing. The machine is also helping itself with all kind of other information, for example, the medical records or other expert opinions or any other information on top of the speech. All these is extracting features or attributes that pertain to the speech and how it conveys the information, which is then interpreted, again, digitally. Sometimes classification is employed, which means that the computer or the machine is classifying the sick from the healthy or different severity classes within the disease. And then it's being given to a doctor to be able to see and maybe accept or maybe discuss some more with the patient or other doctors and decide if to accept the machine's interpretation or not. Let's make it a bit simpler. Let's talk about mobile health, mHealth, as it's sometimes called today. Well, it's just using an app on cell phone or any other media, which records the speech. transfers it to some analysis in a computer, server, or cloud computing, and then sends a report to the doctor. In these kind of applications, an important part is the feedback. So the application or the analysis can be, in part at least, given back to the patient or to the user to see and be updated on his or her health conditions. And the same applies to the clinician, who can also give feedback to the analysis and make it more robust and more informative. How can this help? Well, in the old times, doctors' visits were looking like this. These photos, so the doctors actually sat and talked and looked at the patient. Today, unfortunately, it very often looks like this, where the doctor is engrossed with the computer, typing, looking at things. So sometimes they hardly look at the patient, but it doesn't make them bad doctors. On the contrary, they still listen. And this listening can help the doctors and therefore the machines, if they imitate at some point a doctor, to do the diagnosis and to see how a disease progresses or does the patient get better. It can also be monitoring the treatment efficacy and adjust treatment and doses. It can be used as virtual therapy for patients. And very importantly, especially nowadays in the 21st century, do a population screening and alert for a disease or pandemic. Why use speech? Well, it's just very simple to use speech. We speak anyway. We speak to the doctor, we speak on a cell phone, we speak to each other. It's low cost. All you need is a microphone. It's definitely non-invasive. It can be used anywhere, at a clinic or out of clinic, and it's very accessible. All these are kind of the ideals of a good healthcare, and speech can really help in these kind of applications. So why do you think that speech can work and be able to diagnose and screen and monitor health? Well, in the last 70 years, since speech processing started to be digital due to the progress in computers, a lot have been achieved in extracting information from speech. And these technologies are now able to tell you who the speaker is and what language do they speak and everything about their gender and age and culture and education and socioeconomic status. And of course, tell you what people mean, not only textually, but also what they really mean, if they're talking sarcasm or irony. And of course, they can tell you how do people feel, which is what I'm here for tonight to tell you about. And again, this feeling is beyond the verbal. It's beyond the actually text that people speak about. It's what they convey through the speech. So how do I feel? How do you feel? It is portrayed through speech because speech is being produced by most organs and parts of the body. It conveys things that happen in the diaphragm, in the lungs, in the throat, in the mouth, in the nose, definitely in the brains, the command, the control of all this, definitely in the parasympathetic and sympathetic systems and the hormonal systems. All these are combined in producing speech. So anything that goes wrong somewhere there should be affecting speech and the way it's being heard. So I'm here to teach machines to do it. How can technology really do the same? Listen and be able to extract this information from the speech? Well, I'll give you lots of details about it now, but I can summarize it in one sentence. We humans are just better because our brains have been evolved for millions of years of evolution just for that, to be able to listen and understand each other. Our neural network is just in the brain, it's just better trained. Now, to teach machines to do it, it still has a long way to go before it can actually do it like people do. But still, it can do quite a lot of work and take away a lot of burden from humans doing it. In details, why do technologies struggle with it? Well, to start with, humans have more inputs. We listen to each other, but also look. Machines sometimes have to do just with the recording. And when we look, we see facial expression, and we read lips, and we see gestures and body language. All these gives us lots of information, even if we don't hear very well what's being said. In the COVID time, many people discovered that they have hearing problems just because they couldn't read the lips because of the masks, for example. Then our brains are trained to discard or at least and eliminate some environmental noise. So even in the conditions of noise, we still hear each other and understand each other. Even if we are talking through all kind of distorted channels and cell phones and in noise, and if there are many echoes in the room, still our brains can kind of filter it out. It can also filter out all kind of unclear speech due to natural hoarseness, for example, or very, very problematic accents, like mine maybe. And we're very good in looking at context. So sometimes, even if we don't hear each other well, from the context of things, we can still say a lot about things that were said. So I'm here to try to solve this and still apply machines in listening tasks to humans in order to discover information about their medical condition. So here a little bit more data about myself. I've been working in different aspects of these tasks. In my previous affiliation, I started the Speech Processing Center, AFECA, a Center for Language Processing, which became the bigger speech knowledge center in Israel. Lots of funded research in all type of speech application, including medical ones. I was working with the MIT mechanical engineering robotics lab in the software side of medical robots, interacting with humans. I founded a startup company called Nexig for the early diagnosis of mild cognitive impairment and Alzheimer's disease. And I was a part of one of the first consortia under the sixth framework of the European GC to diagnose and recognize emotion in speech. And these are the research tools that I combined and use in the studies I'll tell you about in a minute. So in itself, speech processing is a very multidisciplinary topic, especially when applied to medicine. But in itself, it has lots of different aspects of science that can be combined in order to solve this really complex problem. So I do use the speech production physiology and lots of signal processing and machine learning. A lot depends on data and how to record appropriate data in order to extract the information needed, which means which patient will be recorded, for how long, what shall they say, etc. And also music theory. And here's a little secret. I started my academic career in the undergrad in the Academy of Music. Some research outputs to describe the wide vista of applications that can use speech. So dementia and Alzheimer, Parkinson's disease, muscular disease, which definitely in the generation of muscles affects speech. Definitely vocal cords and throat problems or kind of ENT disease and disorders can be recognized and classified using speech. And of course, COVID. Not only diagnostic application can use speech, but also rehabilitation and assistive technologies to healthcare. And these are, again, just a sample of my studies on speech in assistive healthcare, from assisting the elderly to assisting people who lost their vocal capability, and people who just have problems with speech, for example, stuttering and the disfluency of speech. Let us look at some example of how this technology look like. So this is our real-time phoneme counting algorithm. I know it's a bit of a mouthful, but what it means is that by giving biofeedback to people who stutter in a simple application on a cell phone, we can help them train and practice beyond the speech therapies sessions and improve their stuttering problem. To do this, the system, the technology needs to be able to quantitatively and accurately measure the rate of speech. So, and this is not an easy thing to do. So this is an example of an algorithm that was able to solve this problem, and using signal processing and analysis of speech to provide this important and accurate information so that people could actually look at the rate of speech over time and correct it accordingly using a cell phone. Not only physiological conditions can be diagnosed and cared for using speech, mental health does too. And here's some work done on depression. Again, another it's a pandemic of the 21st century, which is getting worse lately. All these are naturally speech-based applications, because when going to a psychiatrist or psychologist, people just talk. And this speech can be monitored from home. It can be monitored and transmitted to the doctor, or it can be used again, in the feedback loop to the patient to be able to recognize and monitor the severity of the depression. Let's look at some results of how these things look like in our results description. So what these machines usually do is provide you with what we call confusion table, but it's not confusion at all, because actually it's really clear what's going on. So let me work you through this kind of description of machine working. What the machine provides is prediction. So in this matrix, we have the true condition as diagnosed by doctors, for example, in this case of depression, depressed or not depressed, and what did the machine predict? And this is the way we can judge and evaluate the performance and the accuracy of the machine taking part in this diagnosis. So we see in this graph, and let's look at the left-hand side, that in most cases, the machine predicted the same condition, just as did the doctors. Looking at the middle figure, Here we go into a higher resolution, which means we don't only want to know if the person is depressed or not, but also look at severity levels as provided and defined by the specialist. So we have a low, a middle, and severe depression. And we see here too, by this matrix, seeing the diagonal, this much darker color, which means that the agreement between the true diagnosis and the one predicted are very high. And going farther into farther and deeper resolution, in the right-hand side figure, we see actually the score given by the specialist according to some scale called PHQ. And here too, we see a very marked diagonal showing that indeed the machine was able to predict the severity of the depression according to the PHQ scale, which is a very fine scale of depression level. Emotion recognition is a topic which can be done or dealt with independently, but definitely it is associated with mental condition and with other conditions of a patient or anybody. So starting with some emotion recognizer in our phone, we can go and look at emotion recognition in the medical case. And the technology I use here in these studies is based on music theory. And this is why I put this slide here, because all kind of music, rhythm, tone, and pitch are relevant to our way of expressing emotion when we speak. Just to give you an example of how speech is affected by the tonal of music. So this is a technique called analysis by synthesis. So we synthesize voice, and by synthesizing it, we can really fine-tune all kind of musical attributes of the speech, and then apply it to how the analysis will figure out what emotion has been produced in this speech. So, for example, looking or hearing this.
After I finish this session.
This is synthesized voice.
After I finish this session.
So you see, this is the intonation that makes the two sentences different, and of course, can be then attributed to emotional speech. Here are some emotion recognition papers. This is a book we wrote in this consortium on emotion recognition, which really paved the way to this field. We started in 2004, so it's actually 20 years ago. Wow, long time. And as I promised, speech application can be applied not only on patients, but also on doctors. One of the most challenging, in my view and many other people's, parts of a doctor's job is really the soft skills of communicating, and especially if it's a bad news, to a patient or his or her family. So if we can analyze and provide some feedback on the way doctors speak to patients, this can make them a better communicating doctors. And I know that the University of Nicosia is putting a focus on this in higher years courses in the medical degree. So technology can help here too, to develop empathy in voice, to develop communication skills, as well as other skills that are needed in the regime of hospital and healthcare, like teamwork, ethics, stress management, positive attitude. All these can be diagnosed and by biofeedback helped and treated in those healthcare professionals. Again, just to give you some example from a study we did it in South Africa.
We've got your biopsy results. It's clear
diagnosis of cancer, stage 4. We need to make the arrangements for surgery as well as chemotherapy. Please schedule another appointment with my receptionist.
So this is one.
And we sent those away to the laboratory for some tests. And I have the results here. Are you okay with receiving these results today?
So again, I'm not going to play it all through. Definitely, I won't now make some judgment on these healthcare professional in palliative care, by the way. But in this data set collected over a year of many doctors, we were able to get lots of insights and then communicate it back to the doctors on the way they communicate these bad news. And this is the publication. Healthcare is about communication, and communication is not only to patients, but sometimes to the public. And again, public health is another major aspect of the Nicosia Medical School. Well, how do we communicate to the public health issues? We made this study during COVID. We made it again in South Africa, where we just studied interviews of doctors on the TV, on the main channel of South Africa, where doctors just communicated the same text. Be safe, wash your hands, keep distance. We didn't even touch all kind of controversial studies, as controversial issues like vaccination. Just, be safe. So all these doctors just said the same things, but they said it differently. So we try to study what is the best way to communicate this kind of information to the public in order for this message to be more persuasive and really convince people to do it. So this is how it looked like. Of course, we used only the speech, and this is the publication on this. Last but not least, another crucial topic is not only treating the sick, but treating the healthy to be better and to avoid all kinds of accidents. One of these applies to pilots. Pilots sometimes are very fatigued and shouldn't be in the cockpit flying the aircraft. How can we detect it? Well, using speech, which can then be implemented in a simple application that the pilot will just use on his cell phone in order for the application to tell him if you are just tired or awake enough to be able to take a flight, whether it's a military or civilian. Here too, we got some interesting insights, which are now under publication. And getting back to the technologies, well, it is mostly AI today. As can be seen in this caricature, this ship has sailed. AI is here, we use it. We have to use it very carefully. AI and digital health will be parts of the offering of the University of Nicosia in the years to come in the medical school. The future is here. There are many, many possibilities, but even more challenges, especially with speech, where ethics and privacy is an issue, dependence on machines is an issue, liability, who's to blame if something goes wrong, and many, many more issues are involved. So we have to be very vigilant in applying those technologies and just use them right. As I said before, these kind of research needs lots of people. It's a multidisciplinary effort and global effort of many researchers in many countries that are just working together, happily working together, I should say, in solving these intricate problems. And here is just a very short list of some of my dear colleagues who are collaborating with me on these studies. And a last note, I'm a part of the committee organizing InterSpeech, the largest speech conference, more than 3,000 people yearly. We call it the Mondial of Speech. Unfortunately, this conference should have been this year, 2024, in Jerusalem, and we even labeled it Speech and Beyond. Speech applications for healthcare is also a very dominant part there. However, due to the situation in Israel, this has been moved to Kos, Greece. So everybody who listens and wants to just interact with the speech community, both academia and industry, are very welcome to join us in Kos. It's very close to Cyprus, just as Israel is, in September 24. And very thank you to you all for listening.